Hello everyone and welcome to today's broadcast here from VentureJect. Today we are talking about AI, a topic that is obviously to a medical software company such as ours very near and very dear. So we're super happy to see so many signups, almost 140 today, and we're also very happy to, in a moment, to be welcoming Professor Martin Curley, Professor of Innovation at Maynooth University. As always, we are very, very happy to welcome so many of you onto our live stream today. And please do share in the comment sections below where you are listening in from. It's always super interesting to see how many new countries, how many new cities that we are now reaching out to. Also, please do note that this is being recorded, so you can also find it here on LinkedIn or over on YouTube later on for seeing it at a later stage when it might suit you better. If you have any questions or comments, please do share them in the comments below. We will be monitoring the comment section while we go along, and we will do our best to fit into the 30 minutes today all your questions. And I can see already the first comment is in. Thank you very much, Ben. We will do our best, but we will also be respectful of time. Should there be more questions or perspectives that we do not get to cover within the 30 minutes, please rest assured that we will share with you afterwards in the comment section or reach out to you directly. And we will keep monitoring the comment section if something comes in afterwards as well. So please share with us where you're listening in from. And without further ado, let me introduce to you Professor of Innovation at Maynooth University, Professor Martin Curley. Thank you very much, Martin, for joining us. It's our pleasure that you are taking this afternoon to share with us digitalization and how AI has the capability and potential to improve healthcare. So I'll give the word to you if you will start to shortly introduce yourself. And I have promised to say on behalf of you, Martin, that you will be open to sharing a subset of today's slides afterwards. So also to all of you who wish to receive those slides, do write yes, please, or just yes in the comment section below. Take it away, Martin.
Well, thanks so much, Peter, and hello, everybody. It's a great pleasure to be addressing you here from Maynooth in Ireland. I'm very quickly going to share a set of slides, but we have a really big vision here at the Innovation Value Institute in Maynooth, and what we're looking at is not just a reform of health systems or even a transformation. It's actually a full metamorphosis of global health systems, and we're at a really unique point in time where in the past there was one disruptive technology that showed up and transformed everything, like the internal combustion engine or the railways. But now we have multiple disruptive technologies like AI, like cloud computing, like Internet of Things, that are allowing us to do things that in the past we could never have imagined. And it's great to see so many people from all over the world. I see Cairo, Vermont, Saudi Arabia, Oxford. And what we're trying to do is build a large coalition that can get us to a tipping point where a whole new vision of health and a health system emerges. So I'm just going to share my slides quickly here. And hopefully you can see my screen. And so I'm going to talk to you about Stay Left, Shift Left, 10x, digitalizing health, and AI promoting health. So what I want to introduce to you is a new paradigm, a new policy, and most importantly, a practice for transforming healthcare.
Martin, could you go to full screen in your presentation, if at all 10x. Possible?
It's showing full screen here, Peter, on my desk. So it's not showing full screen for you?
No, we're seeing the other side of your PowerPoint, yeah.
Okay, let's see if this is any better. Can you see this now?
No, now it's Value Innovation Institute. shaping the digital future that works for all. But it's still we're still seeing the PowerPoint where you can edit it.
Yeah, I'm really sorry. It's showing full screen here. Why don't we keep going since we're live? And if we need to re-record, we can do that. Because I am showing full screen here. Let me just try one more thing. Okay, can you at least see the screen? I know you might see the dashboard on the left, but you can still see the screen?
Yeah, we see the screen.
Okay, fine. Well, look, I'm based at Maynooth University. The figure on the right, you'll see the OLUS building, which is Gaelic or Irish for knowledge. We're modeled on the Software Engineering Institute at Carnegie Mellon. And one of the key things we've been working on is this book, the IT Capability Maturity Framework. And it's the gold standard for how large organizations measure and improve the capability they get from IT. And we're building a global coalition of people working with us that have a vision of transforming healthcare. And recently we had Jerome Adams, the US Surgeon General, with us. If you're interested in learning about us, just in the latest edition of Healthcare Digital, there's a nice feature on Maynooth University pioneering the future of digital healthcare. So I want to talk to you about four things. Why is a transformation necessary? What we're going to do about it, how we're going to do about it, and what are the means? And I think we all recognize we've made remarkable progress as a global society, and life expectancy has more than doubled over the last 200 years. But all around, we see healthcare in the headlines, large waiting lists, escalating costs, all sorts of issues. So we need to address that, and disruptive technologies give us that opportunity. And I just want to mention briefly a global community that is emerging, led by the Innovation Value Institute. And we come together once a year during the UN General Assembly. We've created a manifesto called the Manhattan Manifesto, which is about championing a new era of digital health through collaboration, cooperation, and change. And we have a big vision of a totally new kind of healthcare system. And we want to see a massive shift from illness to wellness, from hospital to home, from a clinician-focused system to a patient-focused system or a people-focused system. And the strategy, we've tried to make it very simple, is this idea of stay left, shift left, 10x. That every time we make a technology-driven innovation, primarily digital,
Martin, are you changing your slides? Because we're still just seeing the front page.
Yeah, I am. And I know we tested this yesterday, but
now we see your slides. Excellent.
Okay, well, let's just keep going, with this. And it's unfortunate, but, we can do a re-record if necessary. This is the vision of a new kind of health system that we have envisioned through our Digital Health Symposium at the UN General Assembly. And what I want to show you here is the idea, and we're going to just make some real-time edits so you can see this slide, what we mean by stay left, shift left. What we're trying to do is make technology interventions that all the time are shifting us to the left here. And every time we make an intervention, we're not only able to reduce the cost of care, but we're able to improve the quality of life, the outcome, and the clinician experience and productivity. And we have over 40 data points that we have collected from a network of living labs across Ireland, show that it's entirely possible to make this shift to the left. But we really have to take advantage of all of these disruptive technologies. But it's not just AI, it's the Internet of Things, it's cloud computing, and all of these together can enable us to make this dramatic shift in transforming healthcare. So I just want to give you some examples. This is a picture of myself with one of my colleagues who are part of this grand coalition, Dr. John Sheehan. The green arrow on the right is pointing to an AI-powered digital stethoscope from EcoHealth, and I'm using that, and that's able to detect in a GP surgery, cardiac murmurs or valvular issues that previously would have required an echo test in a hospital to detect. And in Ireland alone, sometimes the waiting list for an echo test can be more than a year. And depending on the circumstances, 20% of people waiting for an echo test may actually die waiting for that test. So now we can do these tests or screenings in a GP surgery. And there are now actually companies in the US who are prescribing this directly to patients. In John's right hand, we're looking at, he's holding a V-scan, which is an AI-assisted POCUS or handheld ultrasound device. And this can do the work that previously required an experienced clinician and a machine 20 times the size to do an echo test in a hospital, and now it can be done in the field. And I'm holding a mobile phone, and both John and I and others think that the mobile phone will be the most important medical device for the 21st century. So we've talked about, stay left, shift left, 10x, and that's the what. That really is the strategy. But how do you coordinate a massive change globally, a metamorphosis, as I suggested? Well, we want to use a methodology, or we are using a methodology called Open Innovation 2.0. And I had the privilege of chairing a high-level European Commission work group for 8 years, looking at innovation strategy. And out of that work came this book, Open Innovation 2.0, which I co-wrote with Bror Salmelen from the European Commission. And this is all about creating what we call a guided, open, collaborative ecosystem where we have everybody working in the same direction towards a shared vision and using shared values. So that's universities, like the University of Aarhus, where Peter Sogard is one of the founders of Ventreject. It's governments, it's clinicians, it's patients and users. And if you're interested in learning more about the power of these open collaborative ecosystems, a couple of weeks ago, I published a paper in healthmanagement.org, and I can recommend healthmanagement.org. It's one of the most widely read journals for health managers. And it talks about the power of guided open collaborative ecosystems and how we can introduce major change in our health systems through using this approach. But here's, kind of the theory in action, and this is a reference from Gales in 2002, a multi-level perspective on innovation ecosystem. So if you look at the bottom left-hand corner, there are lots of smaller innovations that we're aligning with this vision of stay left, shift left, 10x. And ultimately, they will coalesce and come together to drive this much bigger transition and a phased transition to a totally new kind of health system. So I want to suggest that we know more about our car's health than we are our own. So all of our cars have dashboards. Here's an example so we can see how much fuel we have in the tank, our revolutions per minute, our speed, and so on. But as human beings, we don't have this kind of data, and we're much more sophisticated functioning machine than these cars. So what I want to suggest is the idea of the quantified self. And this is a cultural movement, but an idea of actually being able to quantify and measure in real time the performance of our own health, and then to be able to detect very early subtle transitions and detect disease early and reverse it. And we know that today, almost 90% of spending, for example, in the US healthcare system is from chronic diseases. However, we know chronic diseases can't be cured, but if we catch them early enough, we can reverse them. So I want to give you two examples on the spectrum of quantified self. On the right is the most basic. This is a blood pressure reading. In fact, it's my own from a couple of days ago. And everybody should know their numbers. Blood pressure is the single best predictor of future health issues. And we all should be measuring our blood pressure on a daily basis. On the left is a much more sophisticated instrument. And this is a butterfly device. It's an example of a handheld POCUS. And here it's powered by Caption AI. But the chief medical officer of Butterfly, John Martin, he actually diagnosed his own cancer using this device. So this is an example of the spectrum moving from simple blood pressure measurement to quantifying your health using AI-assisted tools. Now, I want to suggest and give a couple of examples of how AI and the quantified self are really powerful. I've been so pleased to work with the VentureJect team, and we were really pleased that Peter Sogard in New York last year and highlighting the VentureJect technology as one of the 5 most important breakthroughs in digital health last year. And this is the VentureJect brochure, and there's lots of research showing that VO2 max is a really important measure of health. And the very first Copernican shift in stay left, shift left 10x is this shift from illness to wellness. So in Europe alone, we're spending 97% of our funding on illness and just 3% on wellness. But VO2 max, increasingly the research is showing that this is a really good measure of health. And just small shifts in spending on illness to wellness can have 10x or exponential returns. So cardiorespiratory fitness, as my slide says, is measured by the maximal oxygen uptake that a human being can take. And in the past, the gold standard of measuring that was getting on a treadmill or a bike in a lab. It's very expensive. It takes time, but it is important to measure. And for example, just a couple of pieces of feedback, in terms of the value having a measure of VO2 health. One study found for every unit increase in VO2 max, life expectancy increased by 45 days. And we've been using the VentureJect in a study with one of the big Irish health insurers. And we found by measuring VO2 max using the VentureJect SeismoFit and putting a senior executive from a software company on a lifestyle intervention, we were able to improve that person's VO2 max by 50% in a period of about 10 weeks. For men, and similarly to women, a 10-unit increase in VO2 max is associated with almost a 70 to 70% lower risk of death from cancer and 11% lower risk of death from all causes. So this is really significant. This is like a silver bullet. So if we just focus on one thing, and we were able to introduce VO2 max as a standard measure when you go to your GP or your health, it would be really powerful. But the problem is today the gold standard is sitting on a treadmill like the treadmill I'm showing you in this picture. And so there's an issue about cost, there's an issue about availability, there's an issue about sustainability, but there's also an issue around access. On the right is, and this isn't an advertisement for VentureJect or SeismoFit, but I genuinely think it's a really disruptive technology that's cheap and it could scale. And it's really easy to measure. There's a very 5-step process in measuring the VO2 max. And if I can give you a powerful example, we're working with the Mater Hospital in Dublin. We're working with patients that have pulmonary arterial hypertension, and we had a patient focus session with them a couple of weeks ago here at Maynooth University. And some of these people, they're using oxygen, they're carrying around portable oxygen bottles. They could never hope to get on a treadmill and have a VO2 max measurement. But now simply using the SeismoFit, they can actually have that measured. and we can use that as a baseline and develop proactive interventions for them to improve their VO2 max. So that's an example of, an Internet of Things device with IoT or with AI working as a proactive wellness measurement. Here's another example of an IoT tool, and I have this device here. It's called a food marble, and this is particularly useful for people that have digestive system issues like, irritable bowel syndrome. And it's another 10x technology. So I'm using this myself, and you can see on the left here, this is a screenshot from my app, which is measuring the amount of fermentation going on in my stomach following a meal. So every time I have a meal, I can look at the amount of hydrogen and nitrogen that's present in my breath. This is strongly correlated with the level of fermentation that's going on in my digestive system. And this is a 10x technology, because previously people suffering with IBS, they might get the opportunity once to do a hydrogen breath test in a hospital. So now they can do this 3, 4, 5 times a day. They can figure out what foods are causing them issues, remove them from their diets. And there are many people that are using this tool, and their quality of life and outcomes have dramatically improved. And this is an example of another phenomenon that we call the reverse innovation pyramid, or the democratization of innovation, where individual engineers or patients are developing solutions that previously in the past would have required a large company like a Philips or a Siemens to develop. Another example is a Freestyle Libre, which is looking at measuring blood glucose in real time. This is a device I often use myself, and it's a key tool in measuring, moving towards the quantified self. So if we were able to create a scenario where all of us in real time can be, measuring our VO2 max, our blood pressure, our glucose monitoring, the level of fermentation in our bloods, we could actually be as sophisticated as the kind of instrumentations that are used in Formula One cars, and we can detect disease very early and look to reverse it, but we can also optimize our health. So in the putting this all together, we're working with Irish Life Health. They're one of our largest Irish health insurers, and we've been using they use the Decadu health score, which is an integrated health score from 0 to 1,000. That's integrating all sorts of data, vital signs, mental health, level of exercise. And, on the left is actually the screenshot of, my current score with the Irish Life Health app and My Life, which is provided free of charge to everybody in Ireland. So what I wanted to, kind of summarize and talk about is this new paradigm, policy, and practice we call Stay Left, Shift Left 10X. Healthcare is really complex. Healthcare innovation is really complex. Everybody's doing so many different things. And what we're saying, if everybody can align together and focus on the idea of stay left, which is about staying well, innovating, or treating people with chronic conditions in the home, doing remote physio in the home, or if you happen to be in hospital, getting you home as quickly as possible using digital technologies, we can do things 10 times better, 10 times faster, 10 times cheaper, 10 times earlier. And I've given you a couple of examples, the SeismoFit from VentureEject, the Food Marble from the Food Marble company. I've showed you the My Life app, the Freestyle Libre from Abbott. Dexcom have a similar blood glucose monitor. All of these cheap tools, they're 10 times cheaper, 10 times faster to use than the incumbent solutions. when they combine together, we can dramatically transform our individual health, but we can dramatically transform global healthcare systems, do a lot more for cheaper and better. So let me stop there. Apologize that we weren't able to show all of those slides in full screen. I'll look at doing a record afterwards so it's available for watching. And let me stop there and hand you back to Peter.
Yeah, thank you. Thank you very much, Martin. And very good examples, very concrete, very interesting with the background and the research that you have done over the past many, many years. Please, everyone, if you do have any questions, now is the time to ask them. We have 5 more minutes. I have a lot of questions for Martin, but I will let you guys come in first. I saw that Ben from the US had a question, or looking forward at least to the perspectives on AI in healthcare. And I will just, while we wait for the questions to tick in, I will go ahead with a few of the questions that is on the tip of my tongue. And Martin, I'm very curious to hear your thoughts on. There is a lot of talk about the pressure on healthcare systems, especially also, as you mentioned, with the increase in chronic disease and how we spent 97% of healthcare funding on treatment, thus only 3% on preventive care. How would our healthcare system look going forward if we are unsuccessful in implementing AI tools such as those you showcase here and others?
Well, if we're unsuccessful, healthcare is really unsustainable. So in the UK, for example, almost 40% of government day-to-day spending is on healthcare. That's up from 20% just a decade and a half ago. But what we found in the data from Ireland is really shocking, as is from the UK. And the BBC recently, their main evening news item, spent a day in the Royal Free in London and sharing lots of the issues. But in Ireland, just to give you the productivity statistics, in the last 8 years, we've added 8 billion in spending. We've added 50,000 healthcare workers, and yet the productivity, the composite output has only gone up 3.5%. So what that shows is we have a massive productivity drop, negative productivity in healthcare. So we can't just, the analogy I like to use is a metamorphosis from the caterpillar to a butterfly. Right now, governments are just feeding more and more money and resources into the caterpillar. The caterpillar is getting faster, but it's moving slower, and the velocity is like a snail moving backwards. Well, what we need to create is this metamorphosis, a health system that's based about the individual, and the mobile phone is the device that empowers us. So in Stay Left, Shift Left 10X, we talk about 10 Copernican shifts, but the 3 most important ones are: number 1, a shift from illness to wellness; number 2, hospital from home; but perhaps the most profound, number 3, is a shift from paternalism to partnership, from doctor knows best to patients know best. So empowering each of us individually to take our health. We wouldn't outsource the management of our bank account to our bank, but that's essentially what we do today. We outsource our health to our GP or a hospital consultant. It's just crazy. And finally, now we have the tools that are democratizing the knowledge. So in the future, we will know more than our doctors going in to see them. I'm already using AI agents on my phone to improve my health, but also, devices. One that we partner with Vox AI, who are a Dublin-based company, and they're already demonstrating, transcribing real-time conversations between doctors and GPs, preparing a really accurate note for the patient and the GP note, and providing notes for the administration, so dramatically improving the productivity of the clinician-patient interaction.
That's a remarkable knowledge that you package into such a relative compact answer, Martin. I'm super excited that you are sharing this knowledge. I'm very happy to see the question from Ben. Thank you, Ben, for also saying it's more of a post-session question. Out of respect for time, we have to end here, but if I may ask you, Martin, if you could answer in the comment section in writing afterwards on Ben's question, then I'm sure everybody would appreciate your thoughts, Professor, on Ben's question regarding
and maybe Peter, just
clinician.
one comment, Ben. I think the clinicians are dramatically, wanting to adopt this. They're under such, productivity and pressure challenges. And the evidence I've seen just recently with my own GP last week when I showed her the Vox AI scribe, she said, when can I have it? And we hope to be starting a pilot with her and her colleagues in about a week's time. So there's a real thirst and drive for using these tools.
Fantastic. Thank you very much, Martin, for joining us and for sharing all of your deep insights into this focus. I know it was very short and it was almost unfair to only give you 30 minutes to unpack such a large subject. I want to say thank you for everybody who's listening, and please do remember that the comment section is open both here on LinkedIn and over on YouTube. So we will be monitoring it, and thank you very much. Wish you all a very good day.
Great. Thanks, Peter. Bye all. Thanks for joining.
Bye-bye.